Canton's Morning News with Pam Cook and Gary Rivers.
Well, let's find out what Doctor of Internal Medicine, Dr. Al Johnson, thinks about all of this. Good morning, Dr. Johnson.
Good morning.
All right, this has got me a little going here this morning. I mean, has it gotten to that point in this country where we can't even shake hands now? We have to fist bump because we're scared of passing germs to one another?
Well, I don't think so, no. The study was just trying to show is that handshakes with contaminated hands can transfer bacteria 5 times greater in this study than a fist bump.
Okay,
but
I see.
It just brings to the forefront the necessity of doing what we know we should do, is to wash your hands after using the bathroom, after sneezing in your hands or coming in contact with potentially bacterial substances, whether it's changing diapers or taking the trash out. We should just wash your hands and use good hygiene on our daily basis.
Now, well, I understand, though, the worst service on the planet is probably our cell phones, right?
Well, I mean, that's one area, yes, that because we cough and spit at them and we handle them also, so they can get contaminated, you bet.
It just made me realize I don't ever want to borrow anybody's cell phone anymore. If you do, I'm going to spray it down first, and that would be a whole other thing. Wow. Well, I mean, do we get too paranoid about that we spray it out? I mean, now we have those hand sanitizers that everybody, we saw it out at all the festivals where they have these hand sanitizers. As soon as you eat something, you wash your hands with that. Is that going overboard, or is that a necessity today?
Well, I don't know it's a necessity, but it sure makes sense to wash your hands before you eat. If you don't have water, like at festivals and so forth, then yes, using the hand gel sure makes sense to cut down on the possibility of spreading any infection. Now, if you have a normal immune system, the likelihood of spreading something is not great, or getting something's not great. But good precaution makes common sense, and so I don't think it's really going overboard. It's a service that's there that we should avail ourselves to and keep down the bacteria.
Now, I had heard some things that people say using like a hand sanitizer too much can actually be a problem. Like, I wouldn't say it makes you immune to germs and things like that, but that is maybe not a good idea to overuse it.
It can dry out your hands in some instances because they're alcohol-based. Some of the original ones were somewhat toxic, and they've gotten most of those off the market now. So I don't know if it decreases your immune system. It probably shouldn't. It's just like there's been some studies that show that people that grow up with animals have less asthma than those who don't. Well, I mean, the reverse of that question is people that have asthma probably don't have pets. It's a two-way street. We have to be judicious with what we say and be logical in how we approach this problem. But it does make sense to wash our hands and to be careful in what we touch. And then if we do get exposed to some things by touching, then to wash it. You can transfer bacteria from your hands to your eyes if you rub your eyes. So common sense makes sense.
Yeah, and I guess, better safe than sorry, right?
Oh, exactly. And, there's people that go overboard that has phobias about different things, and we see those people. But we just have to be reasonable with it. And I encourage everyone to wash your hands at the appropriate times, and particularly before eating or like you say, rubbing your eyes, or if you sneeze into your hand, go wash them. Don't spread the germs around.
Okay. All right. I was just realizing the other night, I guess I should have washed my hands. Oh, well. Oops. Hey, thank you so much. We appreciate this, Doctor.
Oh, you're welcome. Take good care.
Thanks. Bye.